The 7 investigators reviewing state documents spanning the last 5 years, and we discovered more than a dozen pharmacists and physicians in Metro Detroit alone at the center of major investigations. And with their licenses suspended for illegally prescribing and/or distributing drugs, some working in tandem to commit healthcare fraud, sometimes in the millions of dollars.
There's certainly a lot of money to be made by doctors and pharmacists who want to game the system.
U.S. Attorney Barb McQuaid has been at the forefront prosecuting many of these cases.
I think they're hurting the taxpayer, and I also think that they're pumping illegal drugs out on the street, and so they are feeding the addiction by continuing to supply people with prescription pills who shouldn't have them.
Some of those charged have been ordered to pay millions in restitution, others deported to their home countries, and a few simply serving prison time or probation. The biggest case in recent years, Babubai Patel, charged in the biggest painkiller billing scam in state history, offering kickbacks to doctors to write phony prescriptions filled at his own network of pharmacies. It's such a problem, lawmakers in Lansing are beginning a new push for stricter laws. And just weeks ago, the Michigan Department of Licensing and Regulatory Affairs created a new drug monitoring section. Finally, we tracked down some of those the state has suspended. Hi, Dr. Bryan?
Yeah.
I'm Jonathan with Channel 7. Not at all?
No.
Okay. She didn't want to talk, but others did. Hi, are you Dr. Pettaway?
Yeah.
I'm Jonathan from Channel 7. Dr. Willie Pettaway of Southfield.
They charged me with being the third largest prescriber of Xanax in the state of Michigan and the third largest prescriber of narco or hydrocodone in the state of Michigan. Well, they took my license July the 15th on those allegations.
Do you think that was fair?
No. So
the state is wrong?
Absolutely. Because when I looked at the evidence, number one, I'm not an incompetent doctor.
So are you saying that this is just a misunderstanding, you didn't really know the rules?
Well, no, I didn't.
The state's saying you put patients at risk of overdose. That's their words.
Absolutely.
Should you be somebody who's in a doctor's office?
Sure. See, the issue with that is that's a vicious and slanderous allegation because...
by the state.
By the state.
Experts estimate healthcare fraud costs the nation nearly $70 billion annually, many millions of that in Michigan alone, not to mention the human costs and loss of trust for those expected to uphold their medical or pharmaceutical oath. I'm Jonathan Carlson, 7 Action News.
Thank you, Jonathan.